Did you know that the way you brush your teeth, wash your skin, or even trim your nails could be quietly signaling serious health issues to your doctor? Most women don't, and that's exactly why this conversation matters. Because as we age, it's easy to brush off small changes in our hygiene as just part of getting older. But doctors say these changes are often the first signs that something deeper is going on, something that, if caught early, could be treated, managed, even reversed. This video isn't about vanity or appearances. It's about your well-being, your independence, and your ability to enjoy every season of your life with confidence. So if you're over 60 or love someone who is, stay with me. What you're about to learn could quite literally save your life. Mistake 1. Thinking dental care is just about your smile. Let me ask you something. When was the last time you replaced your toothbrush or scheduled a dental checkup, even if you wear dentures? For many women over 60, dental care becomes an afterthought. Life gets busy, priorities shift, and honestly, it just doesn't feel urgent. After all, what's a little bad breath, right? But here's the truth. Poor oral hygiene isn't just about yellowing teeth or sore gums. It's a red flag that your body may be fighting something bigger beneath the surface. In fact, multiple studies have confirmed a direct connection between gum disease and life-threatening conditions like heart disease, stroke, and even dementia. Let me tell you about Eleanor. She's a 70-year-old retired school counselor from Vermont. Bright, independent, always on the go. She brushed twice a day, just like she always had, but she hadn't been to a dentist in years. When her gums started bleeding during brushing, she figured it was just age, nothing serious. But during a routine checkup, her doctor noticed inflammation around her mouth and recommended a full cardiac workup. The results were startling. Eleanor was in the early stages of heart valve disease, caused in part by bacteria from untreated gum inflammation entering her bloodstream. Her mouth, quite literally, had been sending out a warning signal. And Eleanor's not alone. Research from Harvard Medical School shows that women with poor oral health are up to 3 times more likely to develop cardiovascular problems. Why? Because when bacteria from gum disease spreads, it causes inflammation in blood vessels, putting added stress on your heart. For women already navigating menopause, hormonal shifts, and a higher risk of heart disease, this connection becomes even more critical. So what should you be doing? First, check your toothbrush. If it's older than 3 months or the bristles look frayed, toss it. Switch to an electric toothbrush if possible. They're far more effective at removing plaque, especially around the gum line. And don't just brush for 10 seconds. Set a timer. You need 2 full minutes twice a day. Second, floss every night. Yes, every night. If you haven't made it a habit yet, start today. Your gums will thank you, and so will your heart. And finally, schedule regular dental visits. Even if you have dentures, your gums and oral tissues need professional evaluation. Dentists can spot signs of infection, vitamin deficiencies, and even early symptoms of serious diseases, often before you feel anything at all. Let me be clear. Bleeding gums are not normal. Chronic bad breath is not normal. Loose teeth, dry mouth, pain when chewing, none of these are just part of aging. They're messages, warnings. And the sooner you listen, the better your chances of staying healthy, strong, and independent. So don't ignore your mouth. It's not just where you speak, smile, or enjoy your favorite meal. It might be the first place your body tells you that something deeper needs your attention. Mistake 2, showering less often and ignoring skin changes. Let's talk about something we rarely discuss out loud, bathing routines. As we age, it's incredibly common for women to reduce how often they shower. Maybe the water feels too cold, your balance feels a little off in the tub, or your skin just gets too dry afterward. I've heard it time and time again. I don't go out much, so why bathe every day? But here's what doctors are seeing, and it's concerning. Decreased bathing frequency often hides the first signs of internal health issues. Your skin isn't just a protective layer. It's your largest organ, and it's constantly sending you signals if you know how to read them. Take Mary, a 74-year-old grandmother from Michigan. She was always neat and clean, but she'd started bathing just once a week, especially during winter. She said it helped keep her skin from drying out, and honestly, it made sense to her. But during a routine visit, her doctor noticed a strange, yellowish discoloration on her back. Mary hadn't seen it, and no one had helped her check. That subtle color change led to blood tests, which revealed the early stages of liver dysfunction. If her doctor hadn't spotted that patch of skin, the condition could have silently progressed for months. This is more common than you might think. According to dermatologists at the Mayo Clinic, nearly 40% of undiagnosed conditions in elderly patients could have been caught earlier by observing changes in the skin. We're talking about signs of diabetes, heart failure, circulatory issues, and even some cancers. Now, this doesn't mean you have to shower like it's the 1950s, but here's what you can do to stay clean, comfortable, and alert to warning signs. First, aim for 2 to 3 full-body baths or showers each week. Use warm, not hot water, and choose a fragrance-free, moisturizing soap that's gentle on mature skin. After bathing, pat your skin dry and immediately apply a moisturizer while your skin is still slightly damp. This locks in hydration and helps prevent that itchy dryness so many women struggle with. Second, examine your skin regularly. Check for new moles, dark spots, flaky patches, or unusual discoloration. Look especially at areas you might miss: your back, your legs, under your breasts, even your scalp. Use a mirror or ask someone you trust to help. And third, don't ignore sensations like itching, burning, or areas that feel numb. These could signal anything from nerve issues to poor circulation or even early warning signs of diabetes. We take care of our homes. We clean the kitchen counters, wipe down the sinks, vacuum the floors. But your body is your first home. And if you wouldn't let your home go weeks without attention, why let your skin? So the next time you look in the mirror, ask yourself, when was the last time you truly checked in with your skin? It could be telling you far more than you realize. Mistake 3, neglecting nail and foot care and missing what your body's trying to tell you. Here's a question most women rarely ask themselves. When was the last time you really looked closely at your hands and feet? Not just a glance when clipping your nails or putting on lotion, but a real check-in. Because what's hiding in your nails or at the bottom of your feet could be the earliest sign of something serious happening inside your body. Meet Clara. She's 78, lives in Arizona, and she loves summer. She'd always worn sandals, painted her toenails a bright pink, and took pride in staying active. But over time, her nails started to thicken and turn yellow. I figured it was just part of aging, she told me. Ugly but harmless. So she stopped wearing sandals. She hid her feet. What she didn't know was that she had a stubborn fungal infection, and more importantly, it was thriving because her immune system was weakening. A routine podiatrist visit led to blood tests, and those tests uncovered a chronic condition that had been quietly affecting her health for years. Here's the truth. Your nails and feet are like little health reporters. They can reveal early signs of anemia, thyroid problems, circulation issues, even diabetes. Let's break this down a bit. Spoon-shaped nails? That could be a sign of iron deficiency. Yellow, brittle nails might be a clue to thyroid dysfunction or even lung disease. Thick, slow-growing toenails? Often a sign of poor blood flow, which can be a red flag for heart issues or diabetes. Numbness, tingling, or wounds on your feet that don't heal. That's something doctors look for immediately in screening for neuropathy or vascular disease. The scary part? These signs often go unnoticed because we assume they're cosmetic or just age. But doctors know better, and now, so do you. So here's what you can do, starting today. First, trim your nails straight across with a slight curve at the corners to avoid painful ingrown nails. Don't let them grow too long, but don't cut them too short either. And if trimming becomes difficult, don't hesitate to get help. It's not vanity, it's self-care. Second, inspect your feet once a week. Use a hand mirror if needed. Look for dry patches, cracks, wounds, or color changes. Pay special attention between your toes. That's where fungus loves to hide. Third, wear breathable shoes and change your socks daily. Moisture-trapping shoes or socks can lead to infections you won't feel until it's too late. And finally, moisturize dry areas daily, but avoid putting lotion between your toes. That area needs to stay dry. Let me say this clearly. If you notice pain, discoloration, thickened nails, or sores that don't heal, don't wait. These are not cosmetic problems. They are your body whispering for attention. And remember, your hands and feet aren't just there to serve others. They've carried you through decades of life, work, caregiving, walking through hard times and beautiful ones. They deserve attention, care, and love. Take a moment tonight. Run your fingers over your nails. Check the soles of your feet. You might just catch something early enough to change your future. Mistake 4. Hiding incontinence instead of managing it, and paying the price quietly. Let's talk about something that makes a lot of women uncomfortable. Something they'd rather pretend isn't happening. Something they avoid bringing up with their doctor, their partner, even their closest friends. Incontinence. The truth is, over 50% of women over the age of 65 deal with some form of bladder leakage. That's more than half. But do you know what's even more shocking? Most of them never mention it to anyone. They work around it. They wear dark clothes, carry extra pads in their purses, memorize where every restroom is, and in doing so, they slowly shrink their world. Let me introduce you to Diane. She's 72, a retired accountant, sharp as a tack, always organized. But she began experiencing occasional leaks, just a few drops at first. She brushed it off. "I've had kids, it's just normal," she told herself. So she started wearing store-bought pads, planning her errands around bathroom stops, even stopped attending her book club when the meeting moved to a house with no guest bathroom. Then, one summer day, the skin around her thighs broke down from constant moisture. Painful red sores developed, and Diane ended up in the ER. After some testing, doctors discovered she had an underlying bladder condition, one that could have been managed months earlier if she'd just said something. Now, I get it. Talking about bladder issues feels deeply personal. For many women, it touches on pride, privacy, and even feelings of shame. But let me tell you something clearly. Incontinence is not a character flaw. It's a medical issue, and a very treatable one. In fact, doctors now have dozens of modern solutions, from pelvic floor therapy and medications to minimally invasive procedures that can dramatically improve quality of life. But they can't help you if they don't know it's happening. So what can you do right now? First, don't use makeshift products like paper towels or menstrual pads. They're not designed to handle incontinence and can lead to skin breakdown or infection. Instead, choose products made specifically for bladder leaks. They're more absorbent, more breathable, and more comfortable. Second, change frequently and clean the area gently using fragrance-free wipes or warm water. Afterward, apply a barrier cream or moisture shield to prevent irritation. Third, track your symptoms, how often they occur, whether it's triggered by movement, laughter, or urgency. This information will help your doctor determine the right treatment for you. And most importantly, talk to your doctor. They hear about this every day. It's not new. It's not embarrassing to them. And it shouldn't be embarrassing to you. What's far more dangerous is silence. Because here's what no one tells you. Untreated incontinence can lead to falls, urinary tract infections, skin infections, and even social withdrawal and depression. That's the real cost of pretending everything is fine. So ask yourself, gently, have you been adjusting your life around bathroom breaks? Have you stopped going to certain places out of fear you might not make it? That's not freedom. That's fear pretending to be control. You deserve better than that. You deserve to feel confident when you step outside your front door. You deserve to laugh without worry. You deserve dignity, not silence. Mistake 5, cleaning your ears the wrong way and risking permanent hearing loss. It's one of those habits we pick up young, never question, and just keep doing. You get out of the shower, grab a cotton swab, and go digging inside your ear. Feels satisfying, doesn't it? But here's the harsh truth. That clean feeling might be doing far more harm than good. In fact, ear specialists say the #1 cause of preventable ear damage in older adults is improper ear cleaning. Let me tell you about Joanne. She's 69, a retired librarian from Washington State. She had a daily ritual, cotton swabs after every shower. She swore by it, said it made her feel clean and refreshed, until one day she felt a sharp pain, then dizziness, then ringing in her ears that wouldn't stop. She'd accidentally punctured her eardrum, and what started as a simple habit turned into weeks of infection, a painful ER visit, and eventually, permanent hearing loss in one ear, and she's not alone. Otolaryngologists, ear, nose, and throat doctors have warned for years. Your ear canal is self-cleaning. The wax you're trying to remove, it actually protects the delicate inner parts of your ear from bacteria and dirt. Pushing a swab inside only packs the wax deeper, where it can block hearing and cause infections. Even worse, many older women already deal with some degree of hearing loss from aging. Damaging your ears with aggressive cleaning only makes the problem worse and harder to treat. So what should you do instead? Here's the golden rule. Never put anything smaller than your elbow into your ear. Yes, it sounds silly, but it's true. If you're inserting anything into the ear canal itself, you're doing it wrong. Instead, follow these steps. 1. Use a warm, damp washcloth to gently clean only the outer ear, the visible part. 2. If you feel like there's a wax buildup, try over-the-counter ear drops that soften earwax naturally, but only use them as directed and never if you have ear pain or drainage. 3. If you're experiencing muffled hearing, pressure, ringing, or pain, see a doctor. They can safely remove wax and check for infection or other issues. Let's also talk about signs that something might be wrong. Have you noticed your ears itching constantly? A feeling of fullness or pressure? Sudden changes in hearing? These could be symptoms of a blockage, or worse, an infection. And trust me, the earlier you address them, the easier they are to treat. You may be thinking, but I've always cleaned my ears this way. That's exactly what Joanne said, and she wishes someone had told her sooner. Because hearing loss doesn't just affect how you watch TV or talk on the phone. It affects how connected you feel to life, your family, your friends, even your sense of independence. So today, I want you to make one small promise to yourself. Treat your ears with care. They've heard the laughter of your grandchildren, the music that made you feel alive, the voices of those you love. Let's keep them healthy for as long as possible. Mistake 6, ignoring hygiene changes caused by medications. When your body is trying to warn you, by the time you reach your 60s or 70s, chances are you're taking more than one medication. Maybe it's for high blood pressure, cholesterol, arthritis, or something else entirely. But here's something most women are never told. Many medications can quietly affect your hygiene, and those changes aren't just annoying, they can be dangerous. Let me share Barbara's story. She's 76, a retired nurse from Florida, always sharp, always on top of her health. But a few months after starting a new medication for blood pressure, her daughter noticed something strange. Barbara had developed a strong body odor even though she was bathing regularly and using deodorant. At first, Barbara was embarrassed. She started showering twice a day, changed soaps, bought new clothes, but nothing worked. Finally, she mentioned it during a follow-up appointment, and it's a good thing she did. Turns out the medication was affecting her liver. That smell? It wasn't from the outside. It was her body's way of saying, something inside isn't right. Doctors adjusted her dosage, ran some tests, and caught the issue early. But if she'd ignored it, the outcome could have been far worse. So let's talk about what to look out for. Certain medications, especially those that affect your nervous system, metabolism, or liver, can change the way your body smells, sweats, or processes fluids. Some cause excessive sweating, some cause dry mouth, which can lead to gum disease, bad breath, and tooth decay. Others cause skin changes like rashes, discoloration, or extreme dryness. The key here is noticing the difference. If you suddenly feel like you're sweating more than usual, or that your mouth is constantly dry, or that your body odor has changed even though your hygiene routine hasn't, don't just shrug it off. Instead, take these steps. 1. Keep a simple hygiene journal. Just a small notebook or app where you jot down any noticeable changes after starting a new medication. 2. Stay hydrated. Many meds dehydrate your body and dry out your skin and mouth. Drinking more water can help reduce side effects and support your organs. 3. Use supportive hygiene products. For dry mouth, try sugar-free lozenges or moisturizing mouth sprays. For skin dryness, invest in a high-quality, unscented body moisturizer. Avoid harsh soaps. 4. Report anything unusual to your doctor, even if it feels small or embarrassing. Say, "I've noticed this since starting the medication. Could it be related?" That one sentence could save you weeks or even months of discomfort, or catch a problem before it becomes serious. And one important thing to remember, never adjust or stop a prescription on your own. Always work with your doctor. The goal isn't to panic, it's to stay informed, stay ahead, and listen to your body. Barbara once told me, "I thought I was clean, but my body was telling a different story. I just didn't know how to read it." Now you do. So tonight, take a moment. Reflect on any recent changes, how your skin feels, how your breath smells, whether you've been sweating more than usual. These might not just be signs of aging, they might be messages, and they might deserve a second look. Mistake 7. Refusing help with personal care. When independence becomes isolation. There's something deeply powerful about being an independent woman. You've likely spent your whole life caring for others. Your children, your spouse, your aging parents. You've solved problems, kept schedules, managed homes, balanced more roles than most people even realize. So it makes perfect sense that when it comes to your own care, especially something as personal as hygiene, you want to do it yourself. You don't want to be a burden. You don't want anyone to feel sorry for you. And maybe most of all, you don't want to feel like you're losing control. But here's the truth. Trying to do everything on your own, especially when it becomes difficult, isn't strength, it's silence. And sometimes that silence leads to serious health consequences. I want to tell you about Helen. She's 81, a former high school principal, fiercely independent. Over time, her arthritis made it harder to wash her hair. But she didn't say anything. She skipped washing it for weeks, wearing hats to hide the oily buildup. She avoided social outings, even lunch with her grandkids, because she didn't feel clean. Eventually, her daughter noticed the change and gently offered to help her set up a shower chair and install a handheld sprayer. They even found a local caregiver who visited once a week just to help with hair care and trimming her nails. You know what Helen said to me later? "I didn't lose my independence. I gained my confidence back." And that's the message I want every woman to hear. Asking for help isn't giving up, it's taking charge. Sometimes that help comes in the form of tools, long-handled sponges, non-slip mats, grab bars, magnifying mirrors. These aren't signs of frailty. They're signs of smart, proactive living. Other times, help comes from people. A trusted daughter, a caregiver, a nurse, even a good friend. Having someone gently check your feet for signs of infection, help trim your nails, or assist with bathing once a week can make all the difference. And perhaps the most important help is emotional, giving yourself permission to be cared for. You've earned that. Your strength is not defined by how much you endure alone. It's shown in how you protect your health, your dignity, and your joy. So ask yourself, are there hygiene tasks that feel harder than they used to? Do you avoid certain activities because you're worried you can't manage them without help? Have you quietly sacrificed parts of your daily routine out of pride or fear? If so, maybe today is the day to have that conversation with your family, your doctor, or even just with yourself. Because aging well isn't about pretending you don't need anyone. It's about building the support you need to keep living fully, confidently, and with grace. And remember, dignity doesn't mean doing it all alone. It means knowing when to accept love and when to let someone hold your hand, even if just for a moment. You've just walked through 7 personal hygiene habits that may seem small on the surface, but carry big messages underneath. They're not just about cleanliness. They're not about being proper or put together. They are about health. They are about freedom. And they are about honoring the woman you are today. Because your body? It's not what it was at 20 or 40, but it's still talking to you. It's still trying to protect you. Every dry patch of skin, every brittle nail, every little leak or ache or odor, it's a whisper, a nudge, a chance to act early, to stay strong, to keep living on your terms. And let's be clear, there is no shame in aging, no weakness in needing help. You are not less than because you ask someone to help wash your hair or trim your nails. In fact, that moment of asking, that is courage. That is wisdom. You've spent a lifetime taking care of others. Now it's your turn. It's your turn to prioritize your health, to listen to your body, and to show yourself the same tenderness you've given to everyone else. So here's what I hope you'll take away today. That your smile can speak for your heart. That your skin can show you what's going on inside. That your feet and hands are more than tools. They're early warning systems. And that being cared for is not weakness. It's preparation for a longer, healthier, more joyful life. If this video helped you feel seen or reminded you to care for yourself a little more gently, please share it with a sister, a friend, a neighbor. Because this isn't just about hygiene. It's about living well. And if you want more conversations like this, real, honest, and made for women like you, hit subscribe. We've got so much more to talk about. Until next time, be kind to yourself. You deserve it.